All right, welcome everyone to the October Starfish on the Mountain gathering and stuff. And so tonight we're going to talk about healing others through connection. The work that's been done by Vivek Murthy, who used to be our Surgeon General. And I actually heard him on one podcast that I listened to. And then it was amazing that I actually ordered the book as an audiobook. And then I have several podcasts that download onto my phone. And here he was on another one too, The Science of Happiness. He was on that one, and he was on Brene Brown. So anyway, so I just was really fascinated with the work that he's doing. And so it was really hard to make it a short presentation with all of the information. So there's a lot more than what I'm going to present tonight from his work with that. And can you see my screen? Okay. And so we already did introduction. So this is about looking at the art and science of healthcare and sharing experiences to help each other and to lift each other up. And we use the Starfish on the Mountain because we want to lift everyone from the bottom of the ocean all the way to the top of the mountains. And this is a safe place, so we can share. We will record, and then we will be off the recording so that people, everyone can share, and everyone maintains confidentiality. So anything that's said here stays here, and we will be more mutually supportive of each other all the time. And so the Starfish story is it's basically our foundation of everything that we're doing here. And it's a story of how we can make a difference one at a time. And so I will send that out to you, Annalise, and then you can read it later. And I just like this picture here also, that we can all be extraordinary in each other's lives. And that is all that Dr. Murthy has really promoted in his book, is how important that is, to be extraordinary to each other. And I think that's so needed during these times because we all need that extra encouragement. And so just want to start with this and just be mindful of and think for yourselves. And we can talk about this later after we're not recording anymore. But I just thought this was fascinating in looking at who's in your circle. And so like all people, everyone who's in your circle actually affect your life in so many different ways. And so actually making a choice as to who is in your circle. So those who are around you, closest to you, really control your life and really have a big, really you're really reflecting. They talk about in neuroscience about mirror neurons and how we reflect the people who are around us. And so if we let negative people in our lives and be closest to us, how we reflect that negativity. But if we become closer to those who are more positive, then we also reflect that. And so we really have to make a mindful choice. Who is in our circle that's closest to us that we're going to let affect us? And then so that the next circle is the circle of influence. And this is all work that has been done by Stephen Covey. Has anyone read his book, The 7 Habits of Highly Effective People? I've read it actually twice. I love it. And then he also has another book that builds upon it, which is The 8th Habit. And that talks more about, in current society. And so, so I love his work, this Stephen Covey's work. But those who are in that next circle actually really have a huge influence on our lives. And then the ones in that outer circle then are the ones, that are concerned. And that's the way we should really control our lives. And we can control it, and we can make those decisions as to who's in our circles and who's going to influence our lives. And so that's really important. And in one of the other podcasts that I was listening to that will talk about possibly next month, unless someone else would like to do a presentation. But I was listening to another one, and I've got a photo of the book on the last slide, on burnout, and how there's 3 steps to actually acknowledge how people are affecting our lives. And so the first step is really to acknowledge it. And it's 3 A's, the 3 A's of really being mindful of who is influencing your life. And so first is acknowledge. So we have to really acknowledge, like when we get those, elated feelings versus those really negative feelings, and how are people around you actually affecting those feelings of elation or of negativity. And so the first one is acknowledge. The second one then is to assess it. And as healthcare, those who work in healthcare, we do that all the time. And so really thinking about how is this happening and what is it, and doing that assessment. And then the third thing is action. The third A is action. So we have to do something about it. And sometimes in our lives, and Dr. Murthy said, we let situations control our lives, and we have to acknowledge how they actually are affecting it, because they have a huge influence on our lives. And so, so really thinking about who's in your circles or what's in your circles. Maybe it's a job, that you do need a job change or something. And so just really thinking of those circles and how they're affecting your life. And so Dr. Murthy talks about the power of community, and the pictures are over the thing, and how that is actually a public health imperative. And we're going to talk about that a little bit later. But thinking about, again, being mindful of how do we connect to people, and how can we connect to others? How do we help each other? Because it's imperative in our lives that we do this. And how do we love? Do we love through fear? Do we love through trust? Or do we love through panic? And so thinking of all of that. And he talks about how sometimes our lives, especially if his research is in loneliness, and how loneliness is driven by fear, and how we can actually change that to be fueled by love. And so really taking that and turning it around to really create that happiness in our lives, and that connectiveness, and more of a positive thing. And so he talks about, he actually has a prelude in his book related to COVID, and how that responds to everything, all the work that he's done, because it's such an isolating situation right now for everyone, and how we can make a difference with that. And so, doing things for others and helping others, and how that totally can change things around, of a life of loneliness versus a life of happiness and connectedness and everything. So put these pictures on there. Some of them are personal ones. So this one here is one that I got off up on the upper left is one I got off the internet, and how people were getting groceries and they still are to some extent getting groceries for elderly people, all kinds of positive messages all over, and how all the donations that we received at the hospital and in healthcare and everything. The picture on the upper right is from Italy, and Dr. Murthy talks about how in Italy they were singing from their windows, you know, as the healthcare workers were getting off of work, and how they actually helped with the attitudes and the, you know, there is another life besides COVID right now. And so we have to really keep that in mind. And the jump around in Wisconsin was a really cool thing that was started actually in Sun Prairie by someone in Sun Prairie, and had no idea how huge it was going to be grow. And so there's like thousands of people, hundreds of thousands of people now involved with Jump Around. They're not doing the Jump Around on every Saturday, but maybe they'll start now that football has started again too. So it was a good thing on Saturdays to do at 3 o'clock. Everyone would go out and jump around. But that physical activity is what I was, why I put that in there, and how important that is to really do physical activity, however we can do that. You know, and the hearts, we had hearts all over the place, and how that really helped to lift people up and lift spirits and everything. And Zoom calls, the one down in the middle towards the bottom is our family getting together by Zoom, and how we can connect people from all across the United States. And we can, you know, do those two things. And the one on the left is my grandbaby. I had a grandbaby born in COVID. And so we had a parking lot party. We actually were outside the hospital to support them, and they mentioned, my son and his wife just mentioned how much that meant to them, that we were outside tailgating while they were laboring inside the hospital. And so we can do that, and there's so many ways that we can be creative. The middle picture on the right left hand side is, you know, the drive-bys, you know, the drive-by parties. And this was for my grandson, a birthday party, and how much that meant to him. And my son is actually a firefighter, so he got the fire trucks involved and everything. And so it was so cool to have that. And the middle picture is my Mother's Day gift, and my daughter actually gave me toilet paper. So it was so cool to have a gift of toilet paper. So yeah, that was cool. So Dr. Murthy talks about loneliness, and actually it is a public health epidemic now, and they are seeing that loneliness actually leads to all of the chronic conditions that we see. So diabetes, high blood pressure, obesity, addictions, and even death are all related to loneliness. And the research very clearly shows that there's a correlation between all of them. And so everyone needs support. And so we need to figure out, especially during these times, how we can support each other and how we can lift each other up. And thanks to Andrea, she sent me this picture of all of the hearts in the TLC to help to lift the staff up there. And so lots of people did that across the organization. And then, so he talks about how loneliness actually can lead to despair and isolation, which then leads to those chronic conditions. And then togetherness actually leads to optimism and creativity. And so he talks about how our values are so much related to that. Again, getting back to those circles, what choices are we making in our lives, and how that affects either loneliness or togetherness. And we can make those choices all of the time. And he talks about, and in, you know, looking at your life, are you looking, and when you get those feelings, those negative feelings, is it related to individualism, that you want to do things by yourself? Or could we do things better by connecting to other people. So kind of keeping that in the back of your mind. Is this because I am so used to doing something by myself, but yet it could be, we could be connecting to do it, and then also getting that optimism and creativity. And I'm guilty of that. I am so guilty of that, that I'm just going to do it and get it done. And it's easier that way. But yet, you know, we can actually have an impact on other people too by involving them and having them help us. So looking at connection any way that you can. And he talks about all of the different creative ways that we can connect to other people. And he talks about how belonging equals strength. And again, in another podcast, it talked about how our choices are, and I was going to make another slide today, but I didn't get a time. So tension versus tranquility. So you have those choices, tension on one side or tranquility on the other side. Pressure versus peace. You know, you've got those two ends of the spectrum again. Stress versus, hold on a minute, I didn't write it big enough without my glasses. Stress, a stressful situation. Do you want to live a life of stress or a life of strength? So stress versus strength. And then conflict versus confidence. So, you know, there's those two ends of the spectrum, and how we need to make those choices in how we live our lives. So Dr. Murthy also, it really encourages everyone to build a more connected world, because we can make a difference. We can solve most of the world's problems and issues basically by making that connected world. And he talks about how social connection matters. And we just really need to do that connection. And he talks about how no one is exempt. Everyone needs to be connected to others, even though they say that they're okay, they're, you know, and stuff, but they still need that connection. So, and he talks about all of the different aspects, parents, CEOs of companies, teachers, our patients need that connection. And he gives lots of different examples of situations of patients where they've made a difference in patient care by connecting. And he talks in his book about lots of different examples from different hospitals and different ways, or healthcare organizations, and how they did that. Frontline workers, medical professionals, families, basically all people need to be connected. And so key strategies, he has 4 key strategies that we'll talk about. So the first one is spend at least 15 minutes each day with those that we love. And that could be people at work. It could be people in our lives, our families, friends, or whatever, but 15 minutes, and being mindful of actually connecting for at least 15 minutes a day. And then really offer empathetic listening. Sometimes, you know, we're thinking about, we're going to solve their problems as we're listening to them, but we have to just sit back and listen to the person, so that we can empathetically listen and then help them after they're done talking. And sometimes he talks about it in the book is that's all they need, is someone to actually listen empathetically to them. And then it's going to make that other person feel so much better. And he talks about focus a lot. And so really focusing on eye contact, being fully present versus, you know, multitasking and doing other things, be with each other versus, you know, having other things going on in your mind, and really for that 15 minutes, really be that. Give the gift of full attention. And he talks about how that is a gift to each other. And then decrease distractions and decrease multitasking. The next one is embracing solitude in our lives. And sometimes we're not very good at that. And I'm not very good at that because I'm so busy all the time. And I just don't take time to have that solitude. But he talks in the book how you need to connect to yourself before you can connect with others. And so that's so important to have that solitude with yourself and become just really develop that comfortableness with yourself. Check in with your thoughts and your feelings, connect with nature. Nature is very well researched that if you can get outside for even a little bit of time, how that actually lifts your attitude and makes you feel better. So meditation, prayer, art, music, he gives all kinds of different examples. Explore creativity, like he talks about at the beginning of COVID, how we're really creative in how we were going to connect with people, but that has to sustain. It just can't stop with that. We have to sustain that. And then finding comfort and joy and laughter. So those are all proven to actually help yourself and others. And then help and be helped. So service, serving each other and doing things for each other, and is actually that human connection also. So there's so much value in that. And he talks about how important that is to serve others and how much we get back by serving other people. And it really gives us purpose in life when we do that. And when you look at the loneliness, as a lot of times people don't have purpose. And so we have to find that purpose and actually act upon that. Give and receive, check on someone all the time. We talked about that last month, how important that is. Smile, and he talks in the book about how a smile is an international language. Everyone understands a smile. So smile as much as you can. I've been actually making it a point of every person who's on the elevator, I smile at them and I tell them to have a good day. And, it's really interesting how they just light up sometimes just by that little interaction and stuff. But pause, pause is like whenever you're getting really frustrated and stuff, take a pause and just really do that acknowledgement and assessment as to what is going on in your life and what's causing that. So really taking that time to pause. And then deep breathing. Even if you take one deep breath, and another podcast that I was listening to had talked about how you take that deep breath 4 seconds in, hold it for 4 seconds, and then breathe out for 4 seconds, and then hold it for 4 seconds before you breathe in again. And even doing that once actually helps to relieve your stress and anxiety. And so that's really important. So he talks about healthy connections is actually equal to vaccines and the healthy protections that we use for our bodies, for our body, mind, and soul. And so he talks about how we're in this all together and we really need to help each other and keep that in the back of our minds in everything that we do. So shared experiences equals shared bonds, strong bonds, and that creates healthiness for all of us. And so in the book, I found this really interesting. He talks about this guy. It was a patient of his that came in, and he was really lonely and he had won the lottery. And so he was like, well, why are you so lonely? And he was like, he came in for diabetic care is what happened. And he was very obese and everything, this guy was. And he was young. He was really young. I forgot what the age was. But anyway, he talked about how this patient of his had actually lived in a small community and had worked for a family business and was very successful in that family business, and just knew everyone in the town, was very connected and everything. And then he won the lottery. And then he had all this money. So then he felt, this person, this patient of his, felt like because he had all this wealth, he had to do certain things, which were different than the way he had lived before. So he had thought he had to buy this huge house in this affluent neighborhood. And I think he even changed states. He actually moved from where he was to a different state. But anyway, then, you know, he was living with all of these affluent people and everything, and his connection disappeared. And so how his life actually spiraled downward after he had won the lottery, and he made all these different changes in his life. And he had talked to Dr. Murthy about, he just wished he hadn't ever won the lottery. His life was so much better before he won the lottery. And so he talks about how, you know, we sometimes think that wealth is so important in our lives and how much we could do if we had this much more money and everything, and how it doesn't make a difference. It really doesn't make a difference. It's the choices that we make. And so if he would have won the lottery and stayed in his community where he was very connected and still worked in his, you know, family business, and still did that, or if he moved to the other neighborhood but then connected, but no one knew each other in this other neighborhood, they all stayed by themselves and they didn't connect. And so how much that that impacts your life. And so he asked the question, you know, how do you define yourself? You know, and we talked about that in February when we started. What are our values and how do we define ourselves? And we have to think about that and really stay true to who you are as a person is really important with that. And so with that, we can do some reflection as to how can we connect with those in our circles and in our own lives. How can we connect with ourselves better within healthcare as we connect with patients. And Dr. Murthy gives a lot more information about how we can really impact our patients just by connection and thinking about how we're connecting with our patients each and every day. And then mentoring others and helping others. And these are photos, that's my grandson, Boo Boo. And there was a picture earlier, he was actually diagnosed with COVID at 19 months old. And the other picture is my husband and our grandchildren there with all masks on and stuff. So, but we connect all the time. So we FaceTime, we connect by Zoom, we try to do whatever. We have been visiting them and stuff too. So, and then my husband sent this picture yesterday, which I thought was very appropriate to include in here. So I'm not turning my clock back on Sunday. The last thing we need is an extra hour of 2020. So I thought we had to have that laughter in here. So, but we all play a vital role in each other's stories and in our own. And so really being mindful of how we can share our stories, and that's what this is all about on a monthly basis, and we can help each other with that. And I love this quote that I found scrolling through images and stuff like that. So as you grow older, you will discover that you have two hands, one to help yourself and one to help others. And by Maya Angelou, and I just thought that was absolutely appropriate for this. And then need to talk about next month. Our last Wednesday of the month is the day before Thanksgiving. And so we can talk about that if we want to meet, or a different time. And then this book is actually absolutely amazing. And this is what Anne-Marie and I were texting about this book. It was on a Brene Brown Unlocking Us podcast this month. And it's amazing too, the work that these twin sisters actually wrote this book and are doing this work on burnout and the stress cycle. And they talk about how we have to go through the tunnel of cycle, and we have of stress, and we have to finish our stress. And they talked about how, you know, like, and I was like, oh my gosh, that's happened to me. They talk about how we're so stressed and stuff, and then when we have a day off, we get sick, you know? And it's because we didn't finish that stress cycle. You know, it's because we have so many things built up that we didn't work through. And so then when we do finally have some downtime, we get sick. You know, like, because stress affects your body in a negative way. And so they talk about that. So I just thought that that was fascinating too. So yeah, so that's, if no one else wants to do a presentation next month, or if anyone wants to do a presentation on this, I'd be happy to send you, like, or you can actually download Brene Brown's podcast related to this too. So but it talks about how these two sisters are actually wanting to change the world also through the work that they're doing related to stress and burnout. And they do talk about healthcare providers too, and stuff, even though one of them is a psychologist and the other one is actually a musician. So yeah, so anyway, but that's it. So I will stop recording.